Hi, Pat Gavin, CEO of Hunterdon Healthcare here. Today's video is the most important in the series of COVID-19 videos that we've distributed to the public. The videos are normally used as updates on what we're seeing with COVID-19 inside the hospital and our preparedness and different things that we've been doing for that preparedness. As I said at the beginning, this one is really the most important so far. We want you to know and feel comfortable that you can come to the emergency department. We're seeing a lot of people who are putting off serious health conditions based on fear of catching COVID in our emergency department or in the health system. We are executing very specific cleaning protocols, and we want you to know that all of our clinical professionals will take the protective measures, all protective measures necessary to keep you away from the virus and while tending to your medical needs. Under no circumstances should you avoid emergency rooms or wait until you are able to meet with your physician in person if you feel you have symptoms that may be truly serious. Avoiding the emergency room out of fear of the coronavirus could be the difference between life and death. I think that it would be best for our medical experts to explain when and why it is important to visit the emergency room, even during the COVID-19 pandemic. Here to provide more detailed information is Dr. Edward Spector, the Chairman of Emergency Medicine here at Hunterdon Healthcare, and Dr. Glen Tonnessen, Managing Physician of Hunterdon Cardiovascular Services.
Hello, I'm Dr. Edward Spector. I'm Chair of the Emergency Department at Hunterdon Medical Center.
Hi, I'm Glen Tonnessen. I'm Cardiologist and Director of Cardiovascular Services here at Hunterdon Medical Center.
Hello, I'm Edward Spector. I'm Chair of the Emergency Department. But first and foremost, I'm an ER doctor. And we are here to take care of all your medical and surgical emergencies 24 hours a day, 7 days a week, 365 days out of the year. Our new reality is that we are in the midst of a coronavirus pandemic. But people, unfortunately, are still having other emergencies, such as appendicitis, strokes, and heart attacks. The emergency department is the only place to go for a medical emergency when minutes are the difference between life and death, or between a good outcome or a complicated outcome. Do not delay calling 911 if you are experiencing signs of a medical emergency.
The signs of a heart attack in men include chest pain, shortness of breath, pain and discomfort in the arms, the neck, the shoulder, the back, and the jaw. Men can also experience diaphoresis or a cold sweat, nausea, vomiting, or even a heartburn-like sensation. Women who present with a heart attack often will present with chest pain as the most common symptom. However, the character of the chest pain is often described differently as women as a pressure, a sensation of achiness in the chest. Also, women more uniquely will present with a feeling of extreme fatigue. They can be nauseous, they can vomit, they can be dizzy, and sometimes even faint as a presentation of a heart attack. Presenting to the emergency room early is critical for both survival and success in life after a heart attack. If a patient can be seen within 2 hours of the onset of their symptoms, they often will have minimal, if any, long-term effects of the heart attack. If they wait more than 6 hours, it's much more likely that there will be some degree of permanent damage. In cardiology and in the emergency department, we like to say that time is muscle. If the heart muscle can be reestablished with blood flow, and we do that with medications or procedures, often the amount of damage will be minimal to the heart. People should come to the emergency room promptly when their symptoms begin to save their heart muscle. Also, cardiac arrest is a complication that can be present when patients have a heart attack. That's a complication that can be treated readily in the emergency room, but it's often fatal if it occurs outside of the emergency department setting. So we'd like to see patients as soon as possible. Many of these symptoms are similar to what we're seeing with COVID and the flu, and many times the the thought on the patient that this must be anything except the heart is what keeps them from the emergency department. The emergency department is manned with professionals who will point the patient in the right direction to establish the appropriate diagnosis in the safest environment that's possible. Coming to the emergency room promptly when symptoms begin also enables us to get patients to the cardiac catheterization lab quickly. Our door-to-balloon time, which is the time from when a patient presents in the emergency room to when their artery is open using a small balloon, is less than 56 minutes, which is well underneath the national standard of 90 minutes. And again, getting that artery open quickly enables us to reestablish blood flow, enables us to minimize or actually totally avoid damage to the heart muscle, and it's critically important.
The emergency department has policies and procedures in place to keep you safe from coronavirus. We have a full-time greeter at the front of the ED that will mask all patients. Patients with coronavirus symptoms are immediately placed in a room. HMC, thankfully, has plenty of protective gear: masks, gowns, gloves, eye protection. And thankfully, the protective gear really works to protect healthcare workers and to prevent the spread of the virus. Every room is cleaned with ultraviolet light that kills the virus before another person is placed in that room. The culture at Hunterdon has always been to treat patients the way we want our family members to be treated. The pandemic has not changed that culture. In fact, it has only strengthened our resolve. Do not delay going to the emergency department when experiencing signs of an emergency. We are here for you, and we will do everything we can to keep you safe from coronavirus and evaluate and treat your emergency. If you think you do have coronavirus and your symptoms are mild, we will evaluate you in a separate respiratory assessment tent. If the symptoms are severe, such as shortness of breath, difficulty walking a few steps, or talking because of difficulty breathing, low blood pressure, then we will take care of you in the emergency department. My final message is be safe, continue to self-isolate, but if experiencing a medical emergency, do not delay seeking immediate care in the emergency department. We are here for you, we are always open, and we are well prepared to care for you and keep you safe.
Thank you, Dr. Spector and Dr. Tonnessen, for your guidance today. I also have with me Dr. Geralyn Prosswimmer, who is the Chief Medical Officer of Hunterdon Healthcare Partners, to speak about when you are worried about something, but it may not be as urgent as described by the previous physician. So with no further ado, Dr. Prosswimmer.
Thank you, Patrick. I just want to reiterate the importance of the messages you heard today from Dr. Tonnessen and Dr. Spector about going immediately to the emergency room for the symptoms that they described for you. But I want to remind you that your primary care doctor can be very helpful to you if you're not sure what to do. They can be the so-called quarterback of your team. And if you're not sure about whether to seek urgent care or whether to stay home, call your primary care doctor. They can help you decide whether you can take care of your problem at home, or whether a virtual or in-person visit might be appropriate, whether urgent care might be a good choice for you, whether you should drive yourself to the emergency room or even call 911. They're very happy to take your calls. You're never bothering your primary care doctor when you call. We encourage you to do this. Reach out to them. They're there for you. And if you don't have a primary care doctor, no problem. We will help connect you with a primary care doctor who's willing to help you, even if you're not a registered patient there. And our call center can help do that for you. If you call the call center, one of our nurses there will help you find a primary care doctor that can connect you, answer questions for you, and guide you about what level of care to get at what point in time. So rest assured, it's very safe to come to Hunterdon's emergency department. We're taking great care of you and your families, making sure you're safe. Follow the directions of Dr. Tonnessen and Dr. Spector, and reach out to us so we can help you. Mr. Gavin?
Okay, thank you, Dr. Prosswimmer. As a reminder, the emergency department, as Dr. Prosswimmer talked about, remains really well prepared for all of you. And if you're experiencing anything at all, please don't hesitate to utilize the resources at hand. And we really wish for all of you the best of health for your family through the remaining period of COVID-19. Thank you.